Our kidneys perform one of the most incredible functions in the human body. They filter our blood and remove waste through urine. Urine contains various chemicals and waste products, and when the concentration of these substances becomes too high, or if there's not enough water in the urine, they can start to clump together and gradually form stones inside the kidneys. These kidney stones typically grow slowly and often don't cause symptoms until weeks or even months have passed. There are several factors that can lead to the formation of these stones. One of the most common reasons is a personal history of kidney stones. If someone has had them before and received treatment, they are more likely to experience them again. Family history also plays a role. If a close relative, such as a parent, has had kidney stones, your risk of developing them increases. Certain medical conditions like high blood pressure can significantly impact kidney health, and diabetes can raise the likelihood of kidney stones forming in the body. People who frequently eat salty or high-protein diets, especially processed foods like canned goods, are at greater risk of developing kidney stones. A major factor is not drinking enough water, which is essential for kidney function. When we don't consume enough fluids, urine becomes more concentrated, making it easier for stones to form. In this state, waste materials can start to collect and harden over time, and form crystals or stones inside the kidneys, leading to painful symptoms and potential complications. Kidney stones are mainly made up of different chemicals. The most common type consists of calcium oxalate. Other types include uric acid stones and calcium phosphate stones. Many stones remain in the kidneys and cause no symptoms. The real problem begins when a stone moves into the ureter, the tube that connects the kidney to the bladder. If the stone blocks the ureter, it can trigger severe pain that often moves downward as the stone travels. At this point, symptoms such as intense pain in the lower back or abdomen and visible blood in the urine can start to appear, indicating a possible kidney stone. Stones that are smaller than 5 millimeters usually pass through the urinary tract on their own without much trouble, often unnoticed. But larger stones may block the ureter entirely, causing severe pain and discomfort, preventing urine from flowing from the kidney to the bladder, which can be very dangerous. This blockage can lead to infections and further complications, requiring immediate medical attention. The treatment for kidney stones depends on their size and location. To locate the stones, doctors typically use imaging tests like ultrasounds or CT scans in combination with blood and urine tests. Smaller stones often pass on their own with increased water intake. Doctors may also prescribe medications to relax the muscles in the ureter, helping the stone move more easily. Some medicines can help dissolve certain types of stones so they can be flushed out through urine. This non-invasive approach is often the first line of treatment for smaller stones. For larger stones, advanced procedures may be necessary. These stones can cause significant pain and complications if not treated properly. Depending on size and location, doctors choose the best treatment method. Each case is unique and requires a tailored approach. Lithotripsy uses high-energy sound waves to break stones into smaller pieces. This method is effective for stones that are difficult to pass naturally. In some cases, surgery is required to remove the stones. Surgical options are considered when other treatments are not viable. People who've had kidney stones once are much more likely to get them again. To help prevent a recurrence, it's important to drink plenty of water, around 4 to 5 liters each day, and avoid foods that can contribute to stone formation. Since most kidney stones are made of calcium oxalate, it's wise to limit foods high in oxalates. These include spinach, turnips, beans, nuts, and sweet potatoes. Cutting back on these foods can reduce the risk of developing kidney stones in the future.